My name is Diana Valentin, and I am a labor and delivery nurse. And the topic I chose to research is patient generated health data in high risk pregnancies. Many women often face risk factors during their pregnancies, such as gestational hypertension, gestational diabetes, and preeclampsia. And these risk factors often include more frequent monitoring, more frequent care, and more frequent prenatal visits with their OBs. I work in a rural hospital, and that means there's just limited resources, and for many of these patients that live 30-40 minutes away, going to weekly OB visits can become a financial or economic barrier or burden. And so this is where digital technology such as mobile health apps, wearable devices, and home monitoring equipment play an important role in gathering health information and allowing providers to recognize early complications or early symptoms of these high risk diagnoses. Digital technology can also help increase patient engagement and allow patients to be active participants of their health, allowing them to record their symptoms, allowing them to be able to set daily reminders for daily medications, when to check a blood glucose, when to check a blood pressure. It also lets them know that what these symptoms mean, or it can provide education if they're just having a simple question, and it can allow to build communication with healthcare providers over time. And then for healthcare providers, being able to catch early signs can prevent conditions from worsening and reducing the risk of serious maternal and neonatal complications. And so, although implementing these patient generated health data, it requires the initial investment. Healthcare organizations must consider both the short term and the long term costs. And so, initially, yes, expenses will be high, such as including the purchase of the monitoring devices, and as well as integrating the technology into electronic health record systems, training staff, training patients, and providing that technology support, because there can be errors with technology. And so a lot of training and lots of trial and error with, especially with applications and the devices and any equipment that is provided. But however, these costs may be offset over time by reducing emergency department visits. Emergency departments are always over being very packed and very hard, and the wait times can be very long, and so it can help decrease those visits. It can prevent unnecessary prenatal appointments, especially for patients that live in rural areas, and it can also help identify complications before they require more intensive interventions and expensive treatment. Overall, patient-generated health data is an important healthcare technology because it helps improve patient safety. It expands access to prenatal care. It allows providers to notice very small, subtle changes in maternal health, and it increases clinical efficiency as well as enhance maternal and fetal outcomes. And so, as maternal health continues to become a priority for research, patient generated health data provides a practical way to deliver high quality care while allowing healthcare providers to monitor patients beyond traditional prenatal visits. Thank you so much for your time.